Lyme disease in the Netherlands and why we need to act now. In the last 20 years, there have been more than 280,000 cases of Lyme disease globally, spread in over more than 80 countries. In the Netherlands, this disease causes around 27,000 cases each year, of which up to 2,500 develop chronic symptoms. The prevalence of Lyme disease has been increasing, and cases tripled between 1994 and 2017. Moreover, it is expected that this number will increase even more due to global warming. But what does this mean for the Dutch society? Lyme disease caused the loss of 1,750 healthy life years each year, an economic annual impact of 20 million euros, and even further financial and health losses in the next few years due to the rising of cases influenced by higher temperatures. For all these reasons, we need to act now. But what is Lyme disease, and how can we address Lyme disease in the Netherlands? Lyme disease is caused by the Borrelia bacteria and transmitted by ticks of the genus Ixodes. While early symptoms are normally mild and unspecific, late stages of the disease can become chronic and even cause death. Bites of ticks occur in outdoors areas where there is high tree density or high grass. Thus, early diagnosis, prevention of tick bites, and an adequate response to tick bites are important to contain Lyme disease in the Netherlands. The identification of the factors that contribute to the increase of Lyme disease cases allowed us to develop several interventions. Interventions can be done on three levels: primary interventions that aim to reduce infections, secondary interventions that aim to identify Lyme disease in early stages, and tertiary interventions that aim to increase awareness. Primary and tertiary interventions have been selected as the most promising ones. Intervention 1. Providing tick repellent in high-risk areas. Installing repellent dispensers in the entrance of parks, hiking routes, and campings would decrease the spread of Lyme disease by reducing the number of tick bites. This intervention is relatively cost-effective and will need for the conjoint efforts of the government and the private sector. Intervention 2. Increasing awareness among general practitioners. This intervention would improve correct and timely diagnosis of Lyme disease. Though this intervention demands long-term supervision, it is cost-effective and will likely be accepted by the GP community. In conclusion, our recommendations, if implemented jointly, are the most promising and cost-effective ones and will lead to a decrease of chronic Lyme disease healthcare and financial associated costs. Controlling Lyme disease is only 2 steps away, but action is needed right now.
Created using Powtoon.